our role as the health system is to make sure that we identify people potentially at risk of it being a COVID-19 case and immediately giving a mask to the patient showing up, doing an assessment in terms of assessing the risk. Did you travel to China? Did you travel to Iran or those other high-risk countries at the moment? And if yes, put even more measures in place. And if the person is not really sick, then the assessment can stop there. The person returns home and self-isolates for up to 14, actually up until the symptoms resolve, and then we're good. Also, if the person needs more medical care, that because the case is more severe, or needs to be tested, there are very safe ways to do that. So the person having a mask on will prevent any cough or sneezing to expel droplets and expose other people, other healthcare workers or other patients. So that's why we ask people in the waiting room if they have any respiratory symptoms to don a mask, a surgical mask. So that's one thing. If we need to test, what we need to do is we insert a swab in the nose and we get a specimen there. We also get a specimen in the throat, and then we send that to the lab for testing. It takes up to a few days to get the results back. If the person needs acute care or needs to be admitted to the hospital, we have all sorts of infection prevention and control measures, regular measures that we put in place to ensure that there is no chain of transmission, that the virus doesn't spread from the patient to you as a staff person or a physician or to other patients around. So that's also very important to do the assessment when your patient comes up, whether it's for emergency room services or day surgery or other types of services in our system that we offer, that we do an assessment to make sure that we identify people who potentially could be infected with COVID-19. And if that's the case, then we can take appropriate measures and be safe.